Hello everyone, my name is Dr. Nguyen Nhật Minh from Inha University, National Research Center for Sexual Medicine and Department of Urology, Incheon, Korea. We thank the World Journal of the Men's Health for giving us a chance to present our study and video. Our study entitled Three-Dimensional Reconstruction of Neurovascular Networks in Whole Mouth Preparation and Testicular Chamber Section of Mouth Urinary Bladder. The bladder is an organ weakly supplied by nerve and blood vessels. Neurovascular injury as a result of aging, diabetes, hypertension, or hyperlipidemia are known to be involved with the progression of the lower urinary tract symptom. Although previous study had demonstrated urinary bladder innervation and suburothelial microvascular structure in human and rodent at 3D level, an anatomic information about neurovascular networks in whole layer of the urinary bladder are still lacking. In this study, we present an immunohistochemical staining method that delineates neurovascular structure in the mouth urinary bladder by using immunohistochemical staining with 3D reconstruction. We use AIDS with old mouth urinary bladder. The lamina propria and the interstitial muscle layer were dissected for whole mouth staining, and testicular chamber section were prepared for full-thickness bladder staining. Immunofluorescence staining of bladder tissue were performed with a CD31, an endothelial cell marker, smooth muscle alpha-actin, and a smooth muscle cell marker, and MT2 as a pericyte marker, and beta-3 tubulin, a neuronal marker. Reconstructed 3D image of bladder neurovascular system from stack of 2D dimensional image. In this slide, we can see the principle of 3D reconstruction of neurovascular structure in mouth urinary bladder. By stack of 2D imaging, which allow to visualization of anti-neurovascular system. The urothelium and lamina propria from bladder mucosa have numerous folds that disappear when bladder is filled. The reconstructed 3D imaging clearly demonstrates the distribution of the CD31, alpha-ST, and beta-3 tubulin, and their relationship in the urothelium, lamina propria, and interstitial muscle layer. The progression was performed from the series of the 2D imaging, which permit the 2D datasets to be visualized as a 3D image. The 3D imaging clearly demonstrates lamina propria and interstitial muscle layer. CD31 positive suburothelial capillary ablation and mucosal ablation were well recognized in the lamina propria. The microvascular density was higher in the lamina propria than in the interstitial muscle layer. The reconstructed 3D imaging clearly delineates typical wavy appearance of nerve fiber that evenly innervate to the lamina propria and interstitial muscle. CD31 endothelial cells were covered with Ng2 positivity pericyte, especially in the suburothelial capillary bleachers underneath urothelium. In contrast, immunofluorescence double staining of bladder tissue with antibody to CD31 and smooth muscle actin, and subsequent 3D reconstruction with progression deep 25 micrometer reveal that alpha-actin positive smooth muscle cells are mainly expressed in perpendicular blood vessels of suburothelial capillary bleachers, and in blood vessels of mucosal bleachers and interstitial muscle. In this slide, we have performed a high-resolution 3D reconstruction of neurovascular system in lamina propria. A bladder were performed by using whole mouth immunostaining. The complexity of vascular structure and nerve fiber and their relationships were clearly delineated by the progression and 3D reconstruction. The 3D image demonstrates abundant distribution of vascular structure and nerve fiber in the lamina propria. The relatively large blood vessels were covered with alpha-actin positive smooth muscle cells. Moreover, nerve fiber also run very close to the large capillary blood vessel. We also successfully demonstrated the neurovascular structure in digital muscle layer by using whole mouth immunostaining. Similar to the finding in the lamina propria, the large diameter blood vessels are covered with alpha-actin positive smooth cells and run parallel to the nerve fiber. In conclusion, this study provides comprehensive insight into 3D neurovascular structure of mild urinary bladder, and our techniques may constitute as standard tool to evaluate pathologic change in a variety of urinary bladder disease. Thank you for the attention.